Hello, everyone, and welcome to Gulf Coast South Area Health Education Center's Career Chats program. My name is Joan Dixon. I'm the Director of Student Programs at Gulf Coast South AHEC, and it's my pleasure to introduce you to our Career Chat video sessions. You can see on the screen here, we have many different student programs. They are all free to our students in our 4-county service area: Charlotte County, DeSoto County, Sarasota County, and Manatee County in the state of Florida. We have recorded health career presentations on our website. We have these career chat videos with several different wonderful healthcare professionals telling you all about the ins and outs of their careers, so you can see if it's something interesting to you. We offer career camps in the summertime. I work with HOSA clubs, schools throughout our service area. We also have our Reach Public Health Internship Program, and our crowning glory is our Scholars Program, where we spend 2 years of an intensive public health program with students in graduate level programs. 6 wonderful student programs, all for free. You can see our website at the bottom of the screen, my name, my title, my phone number, my email address, so you have no excuse not to contact me if you have any questions about our programs. It is my pleasure to now turn it over to our interviewer for today, Lauren Mask. Lauren, tell them a little bit about yourself.
Hello, everyone. My name is Lauren Mask, and I'm a current intern here at the Gulf Coast South AHEC. In addition to my internship, I'm also a senior at the University of Florida studying health education and behavior. I'm very pleased today to bring to you our special guest, Dr. Nicole Eisenbrown. Dr. Nicole Eisenbrown is a dual board-certified surgeon in both urology and the subspecialty of female pelvic medicine and reconstructive surgery. In addition, she's also an award-winning author to her books, Hurt, and Sometimes I Laugh So Hard the Tears Run Down My Legs. She's also the current founder of Amore Medical Spa, which is a premier destination for aesthetic, continence, and sexual enhancement treatments for women, men, and couples. There are a number of subspecialty areas within the field of urology, some of which include pediatric urology, urologic oncology, renal transplantation, male infertility, calculi or stones in the urinary tract, urogynecology, and neurourology. Now, I want to ask Dr. Nicole Eisenbrown a quick little question. So what made you initially interested in urology?
Well, the short answer is I only have one kidney. So all the people in my family have been urology patients. My sister was born with reflux and duplicated collecting systems and had reconstructive surgery when she was 5. And then when I was 10, I was diagnosed with a non-functioning kidney. And then I had my kidney removed when I was 20. So when I was doing my rotations in medical school, it was just personal to me. So I did it because it was interesting, but it ended up choosing me. So that's kind of the short answer.
Thank you. Yeah, that's awesome.
You're welcome.
All right, now we're going to dive into a quick little video on why Dr. Eisenbrown saw urology as a desirable field to get into.
I'm Dr. Nicole Eisenbrown with Advanced Urology Institute. I'm originally an Army brat, but I grew up in Wilmington, Delaware, and then I moved around quite a bit. This history sort of began in Jacksonville, Florida, when I was working as a pharmaceutical rep. And I was working with one of my physicians that day, and I had the rare privilege of being in his office when he told one of his female patients that she had lung cancer for the first time. She was devastated. She went through every emotion you would imagine someone would at that moment, but I also got to watch how the physician guided her very gently from a place of sheer devastation to a place of hope. And my life was forever changed in that moment. I knew that I would never be motivated by a business goal again, and it was that day I decided to go to medical school. So at the age of 26, I researched, and then I sold my house and packed up my dogs and moved to Gainesville and spent the next 11 years working on my 11-year plan. And 11 years later, I started my first day in private practice in Panama City.
Wow, what a great video. So according to the video, it's my understanding that you originally went to business school and didn't always know that you wanted to go into the field of urology. So could you please briefly describe what a post-bac program is and describe your experience in it?
Yeah, well, my original degree was in business administration, and I worked in the business world for 6 years. And when I decided to go to medical school, I had to do all of the prerequisite courses. There's 8 prerequisite courses for medical school, of which I had none of them. So I had to go do all of those. So post-bac stands for post-baccalaureate. So it's a way to transition from an undergrad degree to a graduate program where you just have to fill in the holes. So that's what that is. So I moved to Gainesville and I had the 8 courses and 8 labs to do. So I did that 2 summers and 2 semesters. And you're kind of in between. It's not a degreed program. You just kind of pay for the courses. And I mean, you're a college student, but you're not in a particular program. It's kind of I don't know, in between. So I did that. That took a year and a summer, and then it took a year to apply to medical school.
Yeah, I think that experience is really great, especially for students who don't know right off the bat what they want to get into, or even if they're interested in healthcare at all. So thank you for sharing that.
Oh, exactly. Yeah.
All right. So could you please briefly go over what your job description as urologist is?
Okay, well, a urologist is a surgical specialty that focuses on the urinary tract. So it's kidneys, ureters, bladder. It also includes the whole male reproductive system. So, the testicles, the penis, the prostate. So, like a lot of people will think, like we're the kidney doctors, but, there's a difference between nephrology and urology. Nephrology is the medical side of the kidney, where urology is the surgical side of the kidney.
Oh, got it. Yeah, there's a lot more that goes into it than I think a lot of people know initially.
Yes, yes.
So where do you currently work and what is that atmosphere like?
Okay, well, I currently am in Orlando. I retired from private practice in 2018, and I'm a hospitalist urologist. But that's I think it's really kind of cool because I get to cover everything in the hospital. Urology, though, I think probably for the students that will be watching this, they're going to want to know what urology is like. So I'll describe kind of more what it was like when I was in private practice. Urology is kind of a really nice specialty because it's kind of 50% clinical and 50% surgical. So I'd spend half my time in the office, half my time in the operating room, which is a nice balance. I'm somebody that kind of doesn't like to sit still very often, and I like lots of variety. So being in lots of different places and different environments is stimulating to me. The other thing I like about urology is that at least a lot of the cases that we have a lot of variety of the kinds of things that we do. We treat stones, we treat incontinence, we treat cancers. So you can do big cases, you can do little cases. I did female pelvic medicine and reconstructive surgery. So I did a lot of reconstructive surgery in women. Prolapse, incontinence, things like that. And I found that very rewarding. A woman, most of the people that are watching this video will have no idea what it's like to not be able to control your urine. But as women get older and they have babies and things like that, then they cough, laugh, sneeze, and they find that they squirt a little urine, and that can be very disconcerting. And it makes a woman very happy when you fix that problem. She can go to aerobics, she can, jump on the trampoline with her kids, and so it's very rewarding.
Seems like it's definitely something where you never get bored, that's for sure.
If you get bored, there's something wrong with you.
There's always different things to do.
Right. And it's very fun too, because you have to think about it. What I do for a living, I'm dealing with people's circumstances that are a little bit uncomfortable or awkward. So you get to know people very well. It's you have to be able to make people feel comfortable, and you have to be able to laugh at yourself. Mm-hmm. So I have fun. I have a lot of fun.
That's awesome. What kind of other health professionals do you work with within the field of urology?
Pretty much all of them. I work obviously in the operating room. I work with anesthesia. I work with nurses. I work with scrub techs. I work with x-ray techs. In the office, we work with obviously medical assistants and nurses, a lot of x-ray technicians. The other specialties that we work pretty closely with would be nephrology, because they're the medical side of the kidney. So they consult us, we consult them. We work with a lot of surgeons, different surgical specialties, infectious disease. We kind of are always involved with the same patients with them because of bladder infections, abscesses, things like that. Infectious disease is often involved. Pretty much anybody that's in the hospital, because we're in the hospital a lot. So we interact with a lot of the specialties that are in the hospital, and obviously primary care, because they refer the patients to us.
Mm-hmm. Gotcha. And so what's the majority patient population look like for patients who are treated in the field of urology?
And you're like, well, it's kind of funny. Everybody thinks urology is a male specialty, but statistically across the board, 40% of urology patients are women. In my case, it was 90% women. And that's just because I'm a female. Females tend to want to be seen by women. So women gravitated to me. I was also the only female urologist in the Panhandle. So I quickly became the go-to person for women, which is why I ended up deciding to go ahead and get board certified in female pelvic medicine and reconstructive surgery. Because actually, when I finished my residency program, one of my favorite things to treat was erectile dysfunction, and doing a penile prosthesis was a really cool surgery. And I thought I was going to be the ED guru, but all my patients were women because I was female. So I was like, well, I'm going to embrace what God is giving me, and I'm just going to take care of women. And it worked out great.
I'm sure you can provide a level of patient comfort, especially within the field of urology towards women when it's stereotypically viewed as a man's field. So that's incredible. You're the only provider of.
People that tend to think of the male GU system and the prostate, but both sexes have kidneys, both sexes get kidney stones, both sexes, women have incontinence and all of that. So literally almost half of urology patients are women. We just tend to think of it as being a male specialty, but it's not.
Yeah, well, you can show all these students that females can do it too, which is awesome.
Oh, absolutely. Hey, shoot, we can do anything.
So what does the typical day-to-day life of a urologist look like?
Well, the way that we handled it was half day in the office, half day in the OR. So I would either show up at the office and see patients from, say, 8 to noon, and then go to we had in Panama City, we had 2 hospitals and a surgery center. So, and then we also had 3 offices. So any given day I'd need to be at one of 6 places. It actually wasn't uncommon for me to show up at the main office and then have them look at me and say, you're at the beach office today. And I'd be like, okay, never mind. I'll turn around, get back in my car. So we, let's say I'll be morning in the office, see patients, then go walk across the street, get lunch at the doctor's lounge, and then, do 4 or 5 cases in the OR or go to the surgery center, or like my block time at the surgery center is Wednesdays. So I would do 4 or 5 cases Wednesday afternoon, and then go home.
Okay. So you never stay in one place too often.
No.
So within urology, do you provide, or your specific workload, do you provide any education or cancer prevention programs? And if so, can you please describe them?
Well, I think that's part of my job, is to help not only treat what they have, but help prevent things. So in urology specifically, one of the things we screen for obviously is prostate cancer. So we get PSAs on people and we follow those. Bladder cancer is very, very common, and bladder cancer is what we call a field defect cancer. It's kind of like skin cancer. You can get a little, something here, and then you have something over here, and then you have something on your back. They're not the same cancer. Your skin was exposed to the same sun. So this cell went bad, and then this cell went bad. And it's the same thing with bladder cancer. So all of your bladder cells were exposed to the same urine. And if you had one little spot that became cancerous, you're prone to have others. So it's a type of cancer that you have to constantly monitor. So we look inside the bladder every 3 months, for anybody who's ever had bladder cancer. So, we do lots of preventative things for that.
That's really interesting. So in addition to those preventative, treatments, what else do you treat at your spa, medical spa?
Oh, at the spa? Well, that's kind of different. that's something that evolved, and it's just something that kind of I've gone into sort of later in life. I've always treated sexual health in men and women. And since I retired from private practice, I kind of embrace sort of the more holistic ways of treating things. I think our society wants to treat things more naturally with avoiding surgery and medications if possible, using supplements or, more holistic therapy. So at my spa, I do non-surgical treatments for sexual health in both men and women using some of these newer technologies. And I specifically do mostly treat erectile dysfunction in men. And it's for those people who might be watching, they might think this is a little sort of an odd area, but it's important. I treat mostly couples. I saw a gentleman in my office just yesterday who's been married for 48 years. And that's kind of the typical client that I have is, happily married couple. They've been together forever. They've raised their kids. They still love each other, but the intimate part of their relationship has kind of slipped away and they miss it and they want it back. And it's, I find it very rewarding to give it back to them.
No, that's incredible. So how many hours a week roughly do you work? And
Well, I'm going to answer that question. I'm sorry.
you can dive into how you worked in private practice or currently at the medical spa.
Yeah, I'm going to talk about it as like a typical urologist. It can vary. I mean, like when I was a resident, now this doesn't happen anymore. So I don't, they have residency laws now. Back when I was a resident, it was, 100+ hours per week. All the time. They now have residency laws, so you can't work more than 80 hours a week and you have to have a 24-hour period off. So it's much more humane than when I did it. In private practice, you get to choose, but I would say the typical urologist works, it's definitely a 40+ hour job, but it's because there's lots to do. And, for example, if you're doing surgery, the time clock doesn't just stop. You have to finish the case, so if it's particularly complicated or you have somebody that needs to be added on, you add it on and you just do the case. So, your days can be pretty long. We also have call, all medical specialties. Well, there has to be call coverage for things. So like in urology, I mean, the ER has to be covered for stones and things like that. People come in with blood in their urine or they can't urinate or they, have a stone and they're in pain. Somebody has to be available to take care of that. Now, call is a little bit different in that, for example, right now, when I'm on call on the weekend, I start 7 a.m. on Friday and I'm not done till 5 p.m. on Monday. Call wise. Now that doesn't mean I'm in the hospital the whole time. That means I just have to be able to answer the call. Now I may not get called or, at 2:00 in the morning, my phone maybe go off and I have to go in and, put a stent in someone or put a catheter in someone, or I can sleep through the whole night. So it can vary, but typically let's say a 40 to 50 hour work week is pretty normal.
So does this amount of time ever get into affecting your personal life at all?
Well, call does for certain. Actually, it's one of my things that I have to keep reminding my husband, like he'll want to make dinner plans when I'm on call. And I'm a big believer that Murph pays attention, and so the second I have him and I'm in a restaurant is when I'm going to get a call, so I try not to make too many plans when I'm on call, just because I get frustrated when they get interrupted. But that's about it. Just having to be available to pull away from what you're doing.
Mm-hmm. Well, it seems like you're very conscientious of when you do have to take those moments away briefly and unexpectedly as well.
Yeah.
So what type of starting salary can a person in urology expect to start making?
Things have changed, but I honestly think the people coming out of residency now are making about $400,000 a year.
Okay.
And the trend is different. Back when, years ago, people went into private practice. Most people coming out of residency now are employees of a system. About 90% of urologists now are employed by a hospital or a hospital system. Like I'm actually employed by a hospital system now, which means I'm more of a salary, in private practice, it's running a business. So your income can vary depending on what the circumstances are. Like, so for example, when I was in private practice, there would be months where I didn't take anything home because the owners of the business are the last ones paid. And for example, we were on a payroll of every 2 weeks. So if you pay in every 2 weeks, that means there's 2 months in the year where you have 3 payrolls. So, and your staff is the most expensive thing that you have. So those would be months where maybe I didn't get paid at all. But then there would be other months where I would make more because it just filtered down. But most people now are salaries. So you work for a hospital system. And right now I'm a salaried person at a hospital. So, and I think that trend is going to continue. And the nice part about that is that the risk, the insurance or the payer risk is transferred to the hospital as opposed to the physician. So like the physicians that I work with at Advent Health, whatever the patient, like we have patients that come in that don't have insurance, for example, there's a lot of that. The physicians at our hospital, they get paid for their activity. So it doesn't matter whether the patient has insurance or not, which is really nice because that means we can really just focus on the patient. We don't care whether they have insurance or not. We don't care what kind of insurance they have. We just take care of the patient. And the burden is on the hospital as to whether they get paid for it.
No, that's really important. And it's great that you guys all provide patient-centered care as well.
Yeah.
So you briefly touched on why you decided to pursue this career, but did you face any challenges along this journey at all, especially within your post-bac program?
Oh, there's lots of challenges. The post-bac program really wasn't any particular challenges other than I was kind of out there on my own. I had to be self-motivated. I didn't, I wasn't in a program, so I didn't have a guidance counselor to recommend what courses to take or anything like that. The biggest hurdle was getting into medical school, the whole application process and all of that. Once I got into medical school, the challenges are just the workload, keeping up with everything, the stress. It's very stressful. Residency, actually, it's kind of funny. I when I talked myself into this 11-year program, I told you it was my 11-year goal. I was like, well, I like school. So med school is going to be fine because I'm a student. I love that. And then the second 2 years of med school, I'm going to be learning what I want to do. So that's going to be fun. And then when I become a resident, I'm going to continue learning. And then they're going to pay me for what I'm doing. So this is going to be great. Well, that's not exactly how it works. Medical school was fine. Residency was extremely stressful and hard, especially the general surgery training. And so you kind of had this slippery slope. It's like, okay, next year is going to be better. And then it kind of really wasn't, but then, but next year will be better, and when I get to urology, it will be better. So it was kind of, but I think that's true of anything in life. If we really knew how our hard things would be, we kind of wouldn't do it. So I think ignorance is bliss in that way. You just kind of go through and you make it through. What were some of the other challenges? Being a female in a male-dominated world, particularly general surgery, was a little bit of a challenge. I didn't really get anything in particular. I mean, nobody ever treated me particularly harshly because I was a female. It's just being a female is different than being a male. Being a wife, and I had a baby in the middle of residency, which was a gift from God that was unexpected, but a real blessing. And that was a real challenge because I was actually the first surgical resident to have a baby during her clinical training at Shands at the University of Florida. So that set a trend, and then a couple other women did it after that. I don't know that the department was particularly happy about that, but we bring babies into the world. That's part of what we are do, and all the careers that we're in need to be able to accommodate that. So I guess in a way, I'm kind of glad I was the one that broke that mold.
I think it's credible.
So that was a real challenge.
You show that perseverance through that entire process, and just show students, especially females who are wanting to go to medical school, that it is possible even to kind of change your mind and have a family outside of just school.
Oh yeah. Well, actually, there's a funny story to that for all the females out there, if I can tell it. One time when I came home this was when I was in private practice, my daughter was 3, and my husband had been a stay-at-home dad. So, but he got a job as a realtor in Panama City. And so when I was tucking my daughter into bed one night, she was about 3, and she said, "Mommy, why did Daddy have to get a job?" And I don't even know what my answer was. It's kind of irrelevant. And she said, "But Mommy, only girls work." And I was just like, wow, she sees the world completely different, because she's like, she comes to my office. All the people she sees are women, the nurses, the receptionists. She might see one of my male partners, but they're kind of the rare. And she goes to daycare. It's all women. And so from her perspective, it's like, well, women do the work, men stay home. I just thought that was kind of interesting. So be interesting. So she sees the world a little bit differently than I grew up, where thinking that men were the ones that worked and women stayed home.
Well, it's definitely incredible that mold is kind of breaking out.
Oh yeah.
With females in the healthcare field. So does somebody in your profession ever experience any sort of traumatic stress or traumatic events as they're participating in urology?
Well, I think if you're in healthcare, you're going to see some things that are very stressful. I mean, even in urology, I mean, I don't deal with a lot of critically ill patients, but patients have bad things happen. People come in, people die. You'll have somebody that you get very attached to that has cancer, and it eventually takes their life. And that can be, you will lose patients, and you have to be able to accept that.
Mhm. So you've briefly gone over how your profession impacts people's lives and making them overall more comfortable, whether it's in their relationships or just independently. But could you briefly go over what the most satisfying part about your career is?
Just helping people. I mean, really, I mean, when you know you've really touched somebody, I mean, there's nothing more rewarding than that. And then sometimes it's little, I mean, or what seems like it's little, you just listen to them. Sometimes they've been to 3 or 4 doctors and nobody's listened to them. And you figure out what's wrong with them, and it just it makes them feel validated. And it's very rewarding if you cure somebody from cancer, or you fix their incontinence, or like one of the very common scenarios, you have somebody come in absolutely in agony with a kidney stone, and then you take their pain away. That can be very rewarding as well. And then just guiding them through what they're dealing with the family members. I now work at Advent Health in Orlando, and it's a tertiary care hospital. And we see a lot of really, really advanced cancers there. So kind of being there to kind of help them, when you're trapped in that kind of situation, you're in the hospital all the time, you're dealing with a lot of tests, you're poked and prodded a lot, and it can get very, I don't know, it can wear you down, so being there to just kind of hold their hand, or just listen to them, or just anything you can do to just kind of make their suffering a little bit less is very rewarding.
No, that is awesome. So on the contrary, what is the least satisfying aspect of your career?
The fact that the government will not get out of our way. The rules and the regulations and insurance, and when you go into medicine, you just want to take care of patients. I know, when we talked a little bit about it just a second ago. I mean, when I was a resident, I just would go and take care of patients. Whether they had insurance or not was completely irrelevant, right? It didn't affect me. I'm now in a situation that, as an employee of a hospital, again, I'm in a situation where I literally just get to take care of the patient. I don't care about whether I have insurance or not, or, any of that. In private practice, it was very difficult. I would go to see somebody and they don't have insurance. Then I have to go through all kinds of things to see if I can get them coverage. Can I get them into our charity program? I couldn't just, I mean, I would take care of them, but I had to try and go through all these hoops to try and make sure that everything came together. They got the tests that they needed. And it's just, that part's very frustrating. The other thing too is that, I kind of joke, it's not joking though, but like the patient and I don't get to decide what medicine a patient's on. the insurance company does.
Yeah.
You know, I mean, and the one that might be on formulary might be the one that has the most side effects. Actually, usually it is, because it's going to be the least expensive. So it's frustrating that there's so much interference in how I care for a patient, whether it's insurance or government, or, you know, they don't qualify for that. You know, I should be able to decide with the patient and I what is the best course of action, and there's just too much interference in that. So that's my biggest frustration.
I think a lot of people look at medical school, especially students, and see it as this bright, shiny object, but not realizing there's a lot of more intricacies that are involved with it, especially when it comes to insurance. But it's great that you can provide that experience and kind of decipher those two and really advocate for patient-centered care.
Yeah.
So what is something that you wish that everybody knew about your profession?
One of the things I wish I had known is that it's open to anybody. I did not even consider going into medicine until I was exposed to it in my mid-20s, because no one in my family is in medicine. And actually what happened was I was a pharmaceutical rep. I was calling on doctors that I didn't necessarily relate to. Then I got promoted to a hospital rep, and I started calling on residency programs. So all of a sudden I was talking to doctors that were my age, had similar interests that I did. I could relate to them, and I was like, so I mean, it's just a decision. You mean anybody can go into medicine? I kind of almost thought it was like royalty. You know, you had to be born into it. Like you had to, your mother or your father had to have been a doctor, you know, like, and I was like, oh, okay, it's just a decision. And so I just, you know, people should, you know, if you like taking care of people, if you like medical things, then you can go into it. Anybody can go into medicine. And there's so many different careers in medicine. It's not just being a doctor. There's you know, nurses and x-ray techs, and there's careers that I never even, like perfusionist. I never even knew about a perfusionist. You know, and that's somebody that works with somebody that's like bypass surgery and things like that. There's like radiation oncology techs, physicists. There's just so many different areas in medicine. So if you like taking care of people, you don't have to be a doctor. You don't have to do the long road. Physician assistant is one of the nicest professions, I think, because the balance between how much school you have to do, the responsibility that you have, and the money that you make, I think is really nice. So that would be like a 4-year undergrad program, and then 2 years as a physician assistant. And then you get to go in and start taking care of patients. You know, you don't have to do the 11-year plan that I did. So I just wish, yeah, if you like the idea of taking care of patients, explore different careers in medicine, because there's so many options, and it's a very rewarding career, and it is open to anybody.
It seems like just in the field of urology, there's so many different subspecialties to dive into as well, which is a great field as well to get into for students.
Oh yeah. And I would say anybody who goes into it, go into it with what ideas you have, but always be open, because I thought I was going to be an anesthesiologist or OBGYN. Well, that's not the way it happened. So we kind of have a saying that you don't choose a specialty, it chooses you. So just be kind of open to what interests you and kind of follow that.
Now, how has your profession changed with the pandemic? And if so, can you please describe those ways?
I would say probably the biggest way it's changed is we do more virtual like this. You know, insurance didn't used to pay for virtual meetings, but virtual meetings can be very helpful in a lot of situations. Like a lot of older people, handicapped people, they can't necessarily get to the office as easily. And sometimes it is just a matter of, let's just communicate. I just need to update your medicines, things like that. Now, there are things in medicine that it's physical. You know, we have to be able to touch the patient. You know, I have to be able to check your urine, have to draw your blood, have to be able to examine you. But there are situations where we could accomplish things virtually. virtually, and this has forced insurance to pay for it, and insurance leads it, so if insurance won't pay for it, it doesn't happen. So now this is going to be an ongoing thing, I think, that is going to be available for patients, which is, I think, good. I don't think we should go completely virtual, because there's something that's lost when you're not there face to face. You guys know that from just being on Zoom meetings. I mean, there's a difference between being there with people in a meeting and being on a Zoom meeting. But it's nice that we can have a balance. I just don't think it should go too far that way.
Yeah, it's definitely nice that there's been an overall increase of accessibility when it comes to different patients getting treated and seeing you. But I understand what you mean by having that face-to-face interaction and taking those samples as well.
The other thing that's happened, which is a negative, is that, a lot of people have missed their screening tests. A lot of people have avoided things. And so unfortunately, we're seeing people that have more advanced diseases than they would have if they had just been doing their regular mammograms and pap smears and things like that. So that kind of is a negative. Because when this first thing happened, we stopped doing all elective surgeries. So then we missed bladder cancers, we missed, prostate biopsies. I myself went 2 years, I was 2 years behind on getting my own mammogram. I haven't been to the dentist since this happened. It's just, and I'm sure a lot of people out there have done the same thing. So yeah, that's
seems like although there are positives, there are some negative repercussions of it as well. But I want to take a step back and kind of do a rewind to back how you were in high school. And could you please briefly describe what type of classes that you took in high school and how, or if they even helped you with your career now?
Well, I went to high school a long time ago, and I had no interest in medicine at the time. So I was just, I just took the general classes that were available then. Students have many more options now than I did. So there are, tracks and programs that if people are medically interested or engineering inclined, they can take those kind of classes. I think those are probably good to just help you determine whether that's the career you want to go into from an interest level. I don't know that it actually helped me in my career. I always remember thinking that college doesn't, well, in most cases, it teaches you how to learn. It's not that unless you become an accountant or an engineer, most of the time when you're in college, it just teaches you how to learn. And then you learn what it is you learn when you go to whatever career you're in. So, yeah, but I just took general classes. I was an okay student in high school. I wasn't a great student. I was like a B student in high school. College is when I really kind of learned, kind of learned to be a good student. So I was an excellent student in college, but high school, I guess, kind of played a little too much. I was a cheerleader and all that kind of stuff.
Now, you briefly mentioned that you went to the University of Florida for medical school. Could you briefly describe what your undergraduate studies look like and just how those atmospheres were at your undergraduate institution and your postgrad studies as well?
Okay, well, I went to University of Tennessee undergrad, and I was a business administration major with a concentration in marketing. So I took all business classes. I think I had one chemistry class my freshman year, and I got a C in it. So not a great resume for going to medical school, but see, I overcame that. So I took typical business classes. And then when I decided to go to medical school, I had to go do the 8 prerequisite courses. So that's when I did the post-bac work. And that was 2 chemistry classes, 2 biology classes, 2 physics classes, and 2 organic chemistry classes with all the associated labs. Those are the typical prerequisite courses for medical school. Did that answer the question, or did I get off topic?
Perfectly. So do you have to continue completing any continuing education classes every year, or like kind of recertify or renew your license every year?
Yes, absolutely. Well, there's 2 sort of levels to that. One is your medical license, which is through the state. And then the other one is board certification, which would be through your board for me, it's the American Board of Urology, but whatever specialty you are, you have a board. So for my medical license, I have to renew that every 2 years with the state, and I have to do 40 CEUs, which is continuing education credits, every year, well, over that time. To maintain my license. Now, for my board certification, there's a process to become board certified, which there's oral boards and written boards, and you become board certified 2 years after you finish residency, and then you have to recertify every 10 years. So, and that's usually you have to submit a case log, you have to submit your CMEs. So you're the continuing med education credits, and then you have to take a written exam.
Okay. So it seems like there's a lot of different tests and stuff that go into it.
Oh, yeah. Well, and that's important because things evolve. And so, I mean, a lot of things that I did in private practice, I didn't even learn about in residency. So you have to keep up with that. One example would be the robot. When I finished in 2002, and we were doing lots of laparoscopic surgery then, but then the Da Vinci robot was invented a couple years after that. And of course we thought, oh yeah, that's not going to become mainstream. It's, the learning curve is too steep, all of that. Well, now every hospital has 3 or 4 robots and everybody's doing robotic surgery. So, obviously you have to continue to learn how to do that stuff and go do trainings. And also the treatment for prostate cancer has evolved hugely since I finished residency. Back in 2002, somebody had prostate cancer, advanced prostate cancer. The only thing we could do was manipulate their hormones. Now there is a dozen different chemotherapy drugs that are available. And so you have to learn about those as they come out. And so I personally like to get my CEUs at meetings, but there's dozens of ways to do it. Some people like to just, do online things where you read a passage or a pamphlet and then you take a test and submit it. I personally like being in like a classroom setting. I learn better from like human beings. So I like to go to meetings, but there's all kinds of ways to get your CEUs.
Especially as technology, everything has gone to a more online format. It's great to see that increase in accessibility, but also the increase of technological devices and tools to help with surgery, such as like the Da Vinci robot and stuff.
Oh yeah.
So can you please briefly describe how you paid for your education?
Okay. All right. Well, I was lucky in that I had grandparents that paid for my undergraduate education. So that was paid for. Everything else after that was on me. My post-bac was probably the hardest to pay for because it wasn't a degreed program, so I wasn't eligible for any loans. But I had saved up a reasonable amount of money working for Pfizer, so Pfizer paid for that. Or my savings that I accumulated from that. But I also waited tables. It was kind of funny. I went from being a pharmaceutical rep to a waitress, but it's kind of like going backwards, but it worked out okay. And then medical school, I took out loans.
Okay.
And I've paid them all off.
That's awesome. All right, so now diving into our last question of the day. What's the best piece of advice for students who are interested in urology?
In urology specifically or medicine?
You could do both, even.
I don't know. Just follow your heart and don't get discouraged. Because no matter what path in life you choose, there's going to be bumps in the road, and that's just part of the journey. So just always keep your eye on the goal. You're going to be able to help people, and just don't let the bumps in the road discourage you.
That's awesome advice. Well, thank you so much for attending this career chat today. I had a pleasure talking with you, and I think that your experiences are kind of a true testament to not only all students, but especially female students who are going into a male-dominated field. So thank you so much, Dr. Eisenbrown. It was a pleasure speaking with you.
Oh, it was fun. I thank you for having me. I appreciate it.
I tell you what, my One of my most favorite parts of my job as a health educator is helping students to explore all of the different options that are available to them within health careers. And Dr. Eisenbrown, you touched on it several times, and I wanted to reiterate it to the students, is there's so many different options. Start your research early. What are you interested in? Because there's more than you realize. There's over 300 careers just in health that you can choose from. And if you decide to go into the medical field, there's well over 100 different specialties to choose from, because you can choose from specialties with age groups like pediatrics or geriatrics. You can choose specialties with diseases like oncology and cancer care. You have specialties for every single part of the body, because all parts of the body matter. So get out there, do that research, look at all the different specialties, because every part of the body matters. And believe me, if you haven't thought about urology before, you should think about it now, because when you need a urologist, you will be thankful that's the specialty they went into, for sure. Students, get out there, do your research. Dr. Eisenbrown, thank you so very much for giving us your time and the expertise, your knowledge this morning. We sure do appreciate it.
My pleasure. My pleasure.
And Lauren, wonderful job with the interview. You both have a wonderful day today.
Thank you.
Thank you.